Hello, everybody. Welcome to episode 4 of Fitlosophy, presented by Better University and hosted by All Access Fitness. Today, we're going to be talking about something very close to me, very close to you, very close to everybody. Today, we are discussing posture. So, everybody
I
sits up nice and tall. Well, actually, it's really funny everybody just did that. So that brings me to kind of my opening point. Now, when you were growing up as kids, how many times did you hear like, oh, that's not proper posture. Oh, you need to do this. Your shoulders back, head up, chin in, trying to walk around with books on your head and things like that. I mean, that's pretty common, right? I mean, maybe not so much for you, depending, but...
Not the books on the head, but the cues for changing posture.
Yeah. So we're going to jump into that in just a second. But before we do that, thanks for tuning in today, guys. Please make sure to hit that subscribe and or the like button. Let us know that you like what we're doing and make it so we can reach more people. Wow, I just realized all three of us are wearing all access
and we're all wearing black, though.
Wow. We did not plan that. This just kind of happened.
We look weird.
No way. And
Nice.
you guys are all in
Let's
black
just
and we
pretend.
have pink pants.
Oh, look
What
at
is
that.
Holy
crap.
That's
Already.
okay.
Doing well.
Anyway.
But that being said, and shenanigans out of the way, we've got Victoria, Danielle, myself, Dan, Scotty, and joining us today as our special guest is Joe McEwen.
McEwen.
Now, I've been practicing that because I've been calling him Joe McQueen since I met him, and he just finally corrected me today.
McQueen.
As much as I want to be Lightning McQueen, I can't.
Understood. All right, so getting kind of back into that first point that we brought up, everybody kind of sat up nice and tall, and knowing that as children we were told, there was a correct posture. Well, for anyone who's not aware, I'm about to blow your mind. There is no such thing as perfect and or correct posture. We're going to pump the brakes on that for just a second. That does not mean there are not bad and or compromised postures, but when we think posture, what we're really talking about are the positions we spend time in. So there is no bad posture. There is only posture your body is either A, not prepared for, or B, you spend too much time in and therefore create an imbalance. So that's the big point to drive home right out of the gate, is so that everybody's aware and everybody knows. There is no bad posture, but if you sit like this all the time with your head leaning forward and your shoulders rolled forward and your lower back not being supported, well, yeah, that's not bad posture. But if you do that for 6 hours a day, 5 days a week, 365 days a year, well, guess what? You're going to create some imbalances that are going to give you some difficulties down the road. And that being said, Danielle, who happens to be a geriatric specialist, has some firsthand experience that she'd like to talk to you guys about today with some of the things that she sees in her line of work from posture positions that have been, put on the body too much too long without balancing that out. So why don't you kick that right on off?
So as I was saying, I was talking to you about it before. It's interesting because we see people sitting like this all day, and then they get up and they're fine. But then the population I work with, you see the end result basically of that.
Right.
So you see the kyphosis, and you can see here in the spine, that's when you're gonna have that hunchback. So you see that all the time. Also, assistive devices they're used a lot, and they use that as a crutch. So for example,
Literally a crutch?
Literally a crutch, and most of the time it's not used right. So there's one of my patients, she was using a walker but was never shown how to use it properly. So what she had the handles down too low, so then she was leaning forward. So now all of her erectors are very lengthened and weak. So it's sad. So now I'm trying to help her strengthen that, but because she was holding that posture and had that movement down for so long, it's hard to change.
Right.
Exactly. So yeah, it's a lot of kyphosis, a lot of leaning on assistive devices, and
Yeah.
those are the main ones.
So coming from that, it is very interesting that you get to see a snapshot of the future. So when you put yourself in those positions, like if you spend all day looking down at your computer screen, you sit in the car, you get home, you sit down, you watch TV, you spend all this time in that really hunched forward anterior field, somewhere down the road, it's going to catch up with you. All those muscles that you're using in that position are going to get really tight and short, and all those muscles in the posterior chain that you're not utilizing are going to get really long and tight.
And those issues just compound on each other
Yeah.
as you go. As you start to have some tightness develop, you and your body will just keep on working into the tightness if you don't
Just
do
adapts
something
to
to
it.
reverse it.
Yes. So that actually brings me to another really good point. I love the fact that I've got Scotty and Joe here to kind of bounce through this with, because when you think personal trainer, if you're not into fitness, if you're not a trainer, oftentimes you think, oh, they're working with athletes, they're working with, people who are, gym goers. That is not the case at all. 9 times out of 10, when I first start working with somebody, I'd say we spend the better part of 3 to 4 months just fixing postures that they've spent too much time in. I mean, the first month of training, after, realigning everything, getting them to utilize things properly, I have them kind of go through a daily checklist in their lives to start to identify the postures that they're spending too much time in, so we can start to build their training program around that to counteract a lot of what they're doing, as well giving them their own mental cues to kind of work things out. So some real life examples that me personally, I've experienced, not clients of mine, but right shoulder. This was always a real big one. So I noticed, I'd say probably 4 or 5 years ago is when I started to really work on this. And just now I'm starting to get to the point where I catch myself doing it very infrequently. Anytime I would go to take a drink of water, I would start about here, and once I got to here, my shoulder would rise up into my neck, and I would finish it. And if I wanted to take more than one sip, I would hold my shoulder up here in my neck as I sipped. Now, once or twice, that's not really a big deal. I mean, even if you did that a couple times, that's not going to cause any issues. But if every single time in your life you picked up a cup and proceeded to hold it up with your trap muscle, well, guess what's going to become really tight and overused over time? I'd say it probably wasn't until I got to my mid-20s that it even started to bug me. I'd wake up with these neck pains. I'd start getting tension headaches coming down that side of my head. So the fix that I found for that was to get a little bit more anterior and underneath with the positioning of my shoulder. So it started very simple. I'd first catch myself feeling very uncomfortable in my trap muscle, and then I'd pull the shoulder blade down and rotate and continue drinking like that. It was a much more comfortable position, and over time, now my right side and my left side, whenever I go or drink something with either hand, it feels very uniform on both sides. So I'm kind of curious if any of you guys have ever experienced anything like that in your life, where you've identified something that you've spent too much time doing and it's kind of become an issue, but you started to kind of bring it back full circle, or at least identify it and start working on it. Off the top of your head, you got something?
I got a good one, yeah.
Ooh.
So I've been playing guitar since 5th grade, and I wear my strap up pretty high. And I got some occipital tension headaches like you were having in the back of my head. And I've been playing a lot more shows recently. So when I'm playing guitar, I'm kind of up here, and I'm not using my delts nearly as much as I should, like you're saying with drinking water. Instead, I'm using my upper delts, and I'm up here playing. And when you get into like a good solo or a good lick, sometimes you do this, which doesn't help either. So I kind of took a step back when I was going through my training during this time, and I was trying to think like, well, I'm not on the computer much. I'm not sitting at a desk. I got a standing desk at home. What could it possibly be? And I was at a gig one night, and then I felt a little pinch in my upper trap, and I was like, that was it. That's it. So ever since that, just like Dan was saying, try to use your delts more, and try to activate those lower traps. So instead of just we'll probably get into this later, but upperly rotating your scapula with your upper traps, it's a combination between the upper and lower. So being able to use that serratus anterior to push those lower parts of your shoulder blades, the whatever, the lower parts of your shoulder blades up, I think that helped out a lot. So that's just one example.
Perfect. No, that's really good. I like that one. We haven't heard from either of you two yet. You got something?
Yeah, so of course, my shoulders, we just did some training, and I have the same exact thing, pretty bad. I bet you if we rewind and watch me drink this, I bet you, I think I drank it like 30
Probably the
seconds
exact
before you
same
said
way.
that, yeah. Anyways, I broke my tailbone like 3 years ago, and it seemed okay, like once it healed and everything, but I was holding my upper body on my lower back, and it did not start hurting me until like this 3rd year. So it goes to show that things can just like go and you can't notice it until it's like too bad. So yeah.
It is. It's one of those interesting
Unfortunate.
things that, it's not bad. So the body's fine for a while. But then once those imbalances start to happen, that's where you get those nagging aches that you start to wake up with. You're like, wow, it didn't feel like this yesterday. What's going on? And you just end up having to deal with that for forever, quite frankly.
After chronic use like that, it can really add up. So actually, I have an interesting one that works in a slightly different way. Years ago, I actually had a cellulitis infection that I almost lost my leg.
Jeez.
Came very close to death. Very luckily, I'm still here, as you can see. But yeah, I had a cellulitis infection in my leg where I was completely and totally unable to use my leg. It was blindingly painful. And so for the time that the infection was taking place, the time I was in the hospital, then especially after the hospital when I was back on crutches and then back on my feet, I really was not able to put anywhere near as much weight on my left leg. My right knee and my right hip started having pretty severe issues over that next year or so. But those issues came on within the first week, I would have to say. Because I got out of the hospital and I think I had 10 days ordered bed rest after the hospital. I think I maybe stayed in bed for 4 of them, and then I was back to personal training the 5th or 6th day.
Not an active job at all.
Not an active job, one bit. So this is years and years ago, and I was literally just using crutches to get from exercise to exercise, grabbing dumbbells and holding dumbbells against the crutches. And then, here you go.
And what personal trainer hasn't done that?
Yeah.
Oh my goodness.
Hopefully.
Hey, you gotta work. You gotta eat.
You gotta do what you gotta do. It's all about the client. But because I was forced to do so much with that side so frequently in such abstract ways from what my body was used to, I created some of those issues quite quickly.
Yeah.
So I thought that was a good little side example.
So I like that you brought that up, because another thing that tends to happen is some of these imbalances and issues that people will deal with in their lives start post-surgery. And oftentimes, here's where I find that the biggest culprit occurs. You finish surgery, you go do your physical therapy, you complete their program, everything's working well, and then you stop. You stop going to see the physical therapist. Well, you completed their program. You say, everything's fine, everything's good, I don't need to do these exercises anymore. Joe, let me ask you a question. As a trainer and a healthy individual, how many times per week do you do physical therapy exercises without actually having any injury you're specifically addressing?
I would say 4 to 5 times a week I am doing either stabilization or accessory muscle exercises.
Yeah.
And with a history of shoulder pathologies, that is a must. I have to do it, or else I will end up in the hospital again, somehow, some way.
Yeah. So branching off that, what ends up happening is we form the patterns of movement over time. And you can't just rewrite that really quickly. The way I used to explain it to my clients is I said, imagine you've got 1,000,000 lines of computer code in front of you, literally 1,000,000 lines of code. And all of a sudden, you're going to throw that code out and you're going to write a new one for that day. Well, the next day when the system boots up to run again, which code is more familiar? The one that it's been using this whole time. So what ends up happening is you do the therapy, you start practicing that new coding, that new movement pattern, and it works for a while. But what ends up happening is you stop thinking about what you're doing. You stop consciously working on those movements and motions, and we start to default back into those old movement patterns, those old habits that might have actually landed you in surgery in the first place. So what I can recommend, and as Joe just very clearly demonstrated, I'm the same way. Every single warm-up I do involves therapy exercises for my shoulders, my hips, my knees, everything. Because I've experienced a lot of really terrible injuries. I've experienced building yourself back up only to lapse back into bad patterns, re-injure yourself, and be like, why am I so stupid? Then finally, at some point, it sinks in and you realize, oh, if I just do a little bit of this frequently, I don't have to overhaul it all the time, right?
That's it.
That whole preventative medicine thing that America is not so
Oh.
They're gonna pass a bill, baby.
Really?
I'll tell you guys more when I know more.
Okay,
No,
all right.
isn't that
Ooh, that'll be a
crazy?
fun,
I'm like,
a fun little thing to go over.
Yeah,
That'd
it
be
already
nice, though.
didn't pass once, but.
Let's talk about this in extent after the.
I know, right?
Yes,
I still
exactly.
looked into it.
It's really cool.
Yeah.
So, trying to bridge in and move on from here. So we've discussed that there is no bad posture. There's only postures we spend too much time in. There's faulty movement patterns that tend to put more excessive wear and tear on joints, ligaments, muscles, kind of create the issues for us. Doing therapy exercises or just practicing better movement frequently will help you avoid all of this. What I want to do next is I want to kind of dive into the very real scenarios that the average human being runs into as far as their posture is concerned. I can think of 3 off the top of my head that almost every single person runs into. Now that being said, people who sit less or people who are on their phones less tend to experience 2 of these less. I'm going to give you guys a quick little shout out. So there's 3 in particular I'm thinking of, 3 postures that the average American spends a ton of time in. Can you identify them?
Forward head, upper cross, lower cross.
Yeah, exactly.
I don't even know
I
what
was
that
going
means.
one at a time. Not fair.
Somebody explain this.
Wow.
Somebody explain this.
This.
I literally just did something.
Right here.
Yeah.
How often are you out and about, standing in a line, and you see this?
Oh, that hurts my neck.
I know.
Now, if you looked at that and said, oh boy,
That's a little better.
if you're spending a whole bunch of time in that posture, in that position, if you take a peek right here at the cervical, the spine that we have diagrammed, by the way, thanks to
Hello.
Joe's wonderful artistic skills, that is an awesomely anatomically correct
That's
spine.
great.
So this top section right here, that's your cervical spine. That is the spine that encompasses essentially what is your neck. It connects up into the base of your skull and comes down right to where your shoulders start to form. Now, when you've got your head completely tilted forward, chin resting against your body, well, this is about a 15-pound piece of equipment you've got up here. More if you've got a larger brain, less if, well, you've got some air in there like me. But that being said, all that weight is pulling forward. So all of those muscles along your neck are being completely stretched out. So they become what we call tight long. Now that being said, cross syndrome, as Danielle threw out there, if you're not sure what that is, that's when one muscle grouping is affected by its opposing muscle grouping. So if all the muscles in the back of our neck become tight long, that means all the muscles in our front of our neck are going to become tight short. So all of a sudden, actually getting your cervical spine back into alignment becomes almost an impossible task. You're fighting these extraordinarily tight short muscles in the front and trying to activate these very weak tight long muscles in the back. Now that's just one example of the neck. I don't want to get too much into that because I don't want to detract from what we're really getting at, but you run into this everywhere in the body. The shoulders, the hips, the neck. We spend way too much time sitting. We spend way too much time looking at these devices way down low, pulled forward. When we're driving in the car, that's the other big one. This is one that I used to have an issue with. Same shoulder, same thing. Shoulder, hand up on the
You're
steering
like
wheel,
this, yep.
driving with my trap.
But
You
that's
gotta
so cool,
drive
though.
like a cool guy though.
Yeah, you gotta
really
see back.
You're not gonna see me driving like this. I'm just kidding.
I have to hang my sleeveless arm out the window so everyone.
I don't have
So everybody knows.
That's great.
So, I mean, that's. Oh, please.
I was like, actually,
Yeah, I've been dominating right now. Please take
Oh,
over.
you have a beautiful voice.
Oh.
So, one of the things I was actually hoping to touch on, Danielle, in your work, you were saying you see a lot of these same things we were talking about,
Yep.
upper cross, lower cross. What do you see that affecting in the lives of these, patients?
I would say just overall health. Because, of course, that goes into all other aspects of their life, like just the way they sit, the way they, like, do everything, So I would just say just overall health and living and well-being. Yeah.
And how's so for instance, I know I've had a few people as clients with pretty severe upper cross, especially lower cross as well, but the mobility issues that they run into.
Mobility, yes.
I've got a couple right now who, through medical conditions even, they're hyper, but
I believe the client I saw you working with yesterday,
Yes,
very
indeed.
classic example.
Yep, and he actually has an arthritic condition, so that
That's
is
another thing, arthritis.
unfortunately
Yeah.
he's
Crazy.
and yeah, it is also like the overuse has compounded that issue, but I mean, he's got very forward rounding and it's tough. It's tough.
so
And you have
tough.
to work with on the bench. You have to do different types of setups, and he even just being able to roll over. If you roll to your stomach and you have bad enough forward shoulder, or especially forward tilt in the spine, your face is in the floor.
Yeah.
You know what I mean? Trying to move positions is different.
Exactly.
And so that was one of the things I wanted to ask you is so in the lives of what can someone look forward to if they don't stop doing this
Exactly.
and if they don't start doing this?
And it's also really discouraging to them because they spent all this time getting to that point that it's going to, of course, take so long to get reversed out of that. And it's really hard to explain that to them and motivate them and keep them consistent, especially at that age.
Spent
And
50 years getting into
exactly.
that posture.
So
Yeah,
it's,
right,
it's difficult.
With chronic conditions,
Yes,
I usually
exactly.
always say, however long it took to get you to where you are, it will take
Right.
that long, if not more, to get you out.
Absolutely. And now try telling a 95-year-old
I know.
that.
It's just tough.
I feel like
You know,
it's just
so it's tough,
their it's
but-
all of their independence.
Yes.
And then you have to just depend on certain things, just like we were talking about the crutches or whatever, like the canes. So then, yeah, it's sad.
So
It is
how
something
about driving, for instance?
So a lot of them don't, actually. A lot of them don't, and it's just dangerous for them. But driving, I honestly don't really do too much with that, and I don't really ask them.
Okay.
So I'm not really sure, but it's really just like the daily living tasks, just reaching, sitting, walking, like a lot of them can't sit to stand. And it's huge.
For anyone listening to that, literally sit to stand is
Yeah,
just
so it's literally just this. But a lot of them have to go like this and push forward, and then some of them fall, and it's
That's a
just,
great example.
yeah.
or do the
Looks
just
like
with
an
the
old
classic
person.
2 arms on one side with the twist around.
Exactly. It's,
Yeah.
it's tough.
And then that'll end up creating an imbalance all on its own.
Right,
course,
and then
yeah.
more injuries from falling, which I see all the time in my
Yeah.
rehab hospital, and it's just,
And then
It's a
surgery
vicious
from the
cycle.
hip.
and then,
Yep.
yeah,
Surgery
wow,
further.
geez.
And then
Yeah.
they
There you
rely on
go.
that hip, and then they have to get surgery on that head. And they
Yeah.
fall and
Right.
Jeez, it all sounds so hopeless.
no.
But wait! There is hope! And you don't have to go and hire a personal trainer, but you should.
Yes.
Tell me more.
So,
Where? Out of where?
Where can you hire a personal trainer?
So that being said, yes, if you don't know where to start, if you are worried about, what the future may hold for you because you do find yourself sitting in a car a lot, sitting at work a lot, sitting at home a lot, forward on your phone, you should seek out a professional to help you identify where your biggest issues are, where your imbalances are, where your weaknesses are, so they can design a program to pull you open.
We all just did that.
Exactly.
But that being said, Some of the things that I want to go through with everybody real quick. Definitely, I know Joe and Scott are going to have some really good things to throw in on this. Danielle's probably got some pretty good stuff. And I know after what Victoria and I have been going through recently with her programming, by the way, guys, quick little note, we've got something special planned for over the course of the next few months. Victoria is taking on formal training with me, and we're going to be documenting her experience through each session.
This is my first time, by the way. So.
What, documenting or training?
No, like actually doing the whole thing.
Oh, okay.
Organized
So,
training.
Yep.
Yeah, so that should be fun. That'll be really cool for you guys to check out too, because, you know, same situation. This is her first time. It's never too late to start. So some of the things that you can do to help yourself, if you're not going to go out and hire a professional, but you should, is to try to identify those postures that you are spending too much time in and try to analyze which are going to be the opposing muscles. So, for instance, we're sitting right now. So that means we're going to have a lot of flexion going on at the hips. So we're looking at abdominal tissue, psoas muscles, hip flexors, quadriceps. These are all in a semi-flexed state. So it stands to reason that if we're in this position too long, those muscles are going to become tight and short. So we can first start by trying to stretch those, open them up. I can tell you the couch stretch, or as I like to refer to it, the Arthur, is a really good place to start. So real quick, we're going to do a live demonstration of the couch stretch right out here in front of the camera. So Joe, actually, would you like to be our little guinea pig?
Absolutely.
All right. So what I'm going to have you do is just kind of put your foot up on that chair, come down into a lunge in front of it, so you're in that traditional couch stretch position. Now you're probably going to want to find something a little bit softer than the hard ground to be putting down on. But as you can see, now that Joe's put himself into this position, it's opening up this entire area of the body that you tend to find gets really closed off while we're sitting. Now, that may be a little bit extreme for people who have never done anything like this before, so the real easy modification, let's stand up real quick. Come on down into a lunge. Voila! Not sure if I was in frame for that.
No.
So you can see, he's still opening everything up. So something as simple as that, working the hips into that stretch is going to help you open that stuff up.
One thing I want to say about this, a lot of people do this hip flexor stretch through high school and they do it for all their sports, but a lot of them do what Dan is doing right now, which is making a nice relaxing little pose where they just kind of lean forward. But then what are we doing here? More hip flexion. We're not really stressing that psoas muscle. So what a lot of people need to do is from their shoulders to their knee, make a nice straight line, and then instead of just leaning forward with your knees, actually posteriorly tilt that pelvis up so it's almost like a hip thrust. And then right here, you'll feel your psoas stretching out. And if you really want a nice anterior chain, put that right arm up.
Love it. So we addressed that real quick. What I want to kind of talk about next in regards to that is once we stretch the front out, how did we then go about strengthening those opposing muscles, right? So those muscles that are going to become tight long from all that sitting we're doing, you've got the gluteal muscles, you've got the hamstrings, you've got some of those lower back muscles. All we need to do is some simple posterior training. Joe, if you could you demonstrate a hip bridge for us?
All right, bridge. Ooh, it's been a while.
Plain and simple.
Oh, this camera's going to film me.
Oh, God, this camera's never
I'll just be the
gonna be
cameraman.
correct angle.
Perfect. So from here, driving that force up, tightening up that posterior chain to generate that lift, he's also opening up the front again. So this is kind of a nice little double whammy for you. And that's it. So we don't want to give away all of the secrets because quite frankly, you should find a professional to help you out,
Yes,
or you
you
should come in and see us at All Access Fitness in Shrewsbury, Mass. But again, you can start to identify the postures you're spending too much time in and then start working to try to strengthening their opposing muscle groups. That's a great place to start. If you don't want to hire the trainer, you should. That's where you want to be moving to. That's where you want to start. Real quick, if you guys have anything else you want to kind of throw down or add to what we're doing before we go into our potential Q&A and wrap up, do we have any kind of last thoughts that we want to throw in on what we were doing?
I do have to say that you should have a personal trainer because you can just really mess stuff up, and I definitely learned that today. Like, I'm not gonna do some stuff alone, for real. So, yeah, it's important.
Having it just in the right way, especially when we're
Yeah.
talking about postural changes
Yeah.
and exercises
like
where you're trying to get functional.
Yeah.
You can, you're talking about working these muscles that are specifically and directly responsible for your posture. So if you're working these muscles, it goes to figure, you're also putting those joints and those bones that we're talking about of the skeleton that we need to align in a weighted position, which also means it's in a risky position if not done correctly.
Yes.
So that's one thing I always like to point out, is especially with your postural exercises, anything when we're working on imbalances or any kind of rehabilitation, and especially, again, rehabilitation, we're also dealing with a post-injury usually. So you have scar tissue, you have tissue that may be held together from post-surgery still by stitches or mesh or something along those lines.
Sometimes, even in some of those surgeries, they'll attach new tissue to
Right.
different places.
Very true, yeah. Or like cadaver
Actually,
tissue.
so to say, I think Joe might have a really good example to kind of dive into
Really?
real
I
quick.
want to hear this.
I'll make it quick. It's a little off topic, but I had a lateral procedure on my right shoulder, which is if you have anterior shoulder instability, if you're a chronic subluxar, a dislocator of your glenohumeral joint, you will get a Bankart repair, which is the repair of the labrum, either anterior or anterior inferior part of the labrum in your shoulder. If that fails, then the ligamentous block is not working, so you need a bony block instead. So what the procedure that I got done, which is very popular in Europe, they don't even do it. They don't even do Bankarts in Europe anymore. They just do these because they're more successful, less re-injury. They cut off your coracoid process, which is a part of your scapula, which sits right under your clavicle. They chop that off. Your short head of your biceps and I think your pec minor is attached to that.
Yeah.
Yeah. And then they drill that into the front part of your glenohumeral joint. So instead of a labrum having to prevent the anterior dislocation, there's a big piece of bone. So now the short head of my biceps is attached in a different spot than other people. Fun fact. Does that lead to muscle imbalances? Yes, it does. I had to work on my bicep strength substantially after that. But then again, people that have ACL surgeries will have the tightest hamstrings in the world, and working on quad development will be extremely hard because of that. What was the word where the muscle on the other side is tight because the other one was too...
Cross syndrome?
Exactly.
Oh,
And that could happen. So, any post-op, you're going to have these muscle imbalances that you need to correct. That was a little long, yeah.
Well, yeah, and especially in something like that, and that's a great example. I actually didn't quite realize that they've done quite that much.
Yeah,
Wow, that's crazy.
Yeah,
it seems like a lot, but it's a very successful surgery done by Dr. Latterger. He is French, smart guy.
If
Figured
he's
that out.
French, he must be
Must be smart. There's one thing you're going to learn from this podcast is that French people are genius.
Fantastic.
Sorry.
Good point. No, it's good.
Well, that's a great example though, that if you do have surgery and if they're severing tissue and you're think about that, you're severing the tissue, So afterward, even if it's reattached, you're gonna need to build that back up over time. It's not gonna be the same as the other side, so you're gonna need to find some way for your body to adapt and rebalance, and that can be a difficult process. So
It's an adventure.
Yeah.
it's a quest.
Yes.
A quest to health. But like you were saying before about PT, follow-up from your PT is insanely important. So how much do you do specifically for that? Or how much did you do after?
I did a lot. Thankfully, I'm in a physical therapy major. I'm an athletic training major. So I thankfully can do a lot of self-treatment based on my knowledge, which is very thankful for
Which
that.
are crucial for having that being.
Yeah, especially long-term, keeping up with it like we were talking about earlier, always doing those stability for me, rotator cuff exercises is key.
Nice.
All right. Unfortunately, we've pretty much run to the end of our time, and that's going to be our show for today. Now, the most unfortunate part is we went offline about 6 minutes ago, so I'd ask you guys to do Q&A, but unfortunately, you're not actually going to be able to do any Q&A. However, what you didn't get to see if you were watching the live feed, I will be putting this up in a pre-recorded. So you'll still be able to catch everything that you missed. Don't worry about that. I know I'm saying that right now like you can hear me. You'll be hearing this later. So thank you everybody for watching. Thanks for checking this out. Subscribe, hit that like button. Let us know you're enjoying what we're doing and help us reach more people. And of course, if you do have any questions, since we can't do the live Q&A, please feel free to drop some questions down in that comment section. I promise you we will get back to you real quick.
Or stop by and see us at
All Access Fitness in Shrewsbury, Massachusetts. Thanks again, everybody. Have a wonderful, awesome night. Uh-oh.